Their strike is only 2 days old, but already patients are bearing the brunt of the industrial action. The suspension of services by the Health Services Workers Union is over their conditions of service, which they describe as poor. In the Ashanti region, healthcare delivery has grounded to a halt. Ohim Interior of our health desk reports that hundreds of patients have been left stranded.
Health facilities have been reduced to ghost towns following the industrial action by health services workers. The usually busy outpatient departments are virtually empty, with no activities. There are no winding queues, just empty spaces. Few nurses idling around take time to speak to some patients caught up in the strike. Many patients had no prior information of the strike by members of the Health Services Workers Union. This woman brought her sick baby to the Komfanoche Teaching Hospital, but was shocked to see this empty space.
I came for a review. My child had a surgery, so I came for a review today. Unfortunately, they are not around because I thought I was coming to see the doctor as they've already given me a date. But when I came and I saw that nobody was around, I was shocked. The place is always busy. So many chairs. You see the place busy, doctors going around, nurses working as usual. But today the place is empty and I'm quite disappointed.
The leadership of the Health Services Workers Union is satisfied with the high level of compliance by members. Douglas Kusi is the local branch chairman at the Komfanoche Teaching Hospital.
Virtually the hospital has become a ghost town. In fact, if you come here every other day, I mean, how busy, especially when we are standing here. So if you look at today, then it means that it's a very pathetic situation, you know, for all of us. But the question that probably you ask yourself is that who do you blame? Is it the Health Services Workers Union or government? And I'm sure your guess will be as good as mine. Because, you know, we are giving government adequate notice. In fact, if you look at this, the reason why we are even on strike, but the negotiations started since 2019. What has even pushed us to take this action is that we feel that we are being discriminated against. In fact, if you go around the hospital, it's not here alone, everywhere, you know, activities have come to a halt. But I feel that it's very sad because as for sickness, I mean, all of us can fall sick at any point in time. But there's nothing that we can do about it for now.
Meanwhile, management of health facilities, including CARTS, say they have instituted measures to ensure patients with emergency needs receive care. From Kumasi, for JoyNews, Ohim Interior reporting.
And the impact of the strike is also being felt in the northern region. Correspondent MARTINA BUGRI joins us via Zoom. MARTINA, what can you tell us about the strike in the region?
Region at the Tamale Teaching Hospital, they are not admitting new patients, and only those who are currently on admission are being taken care of. Now, even those who are currently on admission, the situation is not good for them at all because there are no cleaners to ensure that the place is clean, and so the place is very filthy. You go around the whole hospital and the entire place is in a mess. People who have stroke and would need physiotherapy cannot actually get that now. Children who are malnourished and would need nutritionists and dietitians cannot have that service as well. And major other services are currently not taking place. And when I spoke to the public relations officer of the Tamale Teaching Hospital, Ms. Bao Mohammed, he described it as everything has broken down. The system is broken down because nothing is coming in and nothing is going out. It says that they are suffering indeed because the whole place is in a total mess. That's how he described.
Martina, this is the situation in Tamale, the capital, and of course the Tamale Teaching Hospital. But what have you gathered about allied health facilities within the region? How effective is this strike?
Now, it's across the entire region, and so not just Tamale Teaching Hospital, but the other satellite hospitals in the metropolis are also affected. And what we are being told is that they would not move in, they would not work until they get something positive from government. So this means that it's going to affect every health facility in the region. Now, the peculiar problem of the northern region is that already we don't have too many health centers. And so with this strike coming in, it means that it's going to make the situation more worse than it's already in the region.
Do you have any word from hospital administrators on how they are managing this situation?
When I spoke to the PRO for TTH, he says that there is nothing they can do. Somebody has been employed to clean, the person is not there. Somebody has been employed to take x-ray, the person is not there. They don't have anything they can do now. Now, patients who need to be treated, the doctors are there, the nurses are there, but those who would help them with the necessary materials they would need to, the logistics they would need to work are not there. So how do they work? They definitely can't work. That's the situation.
Very well. Martina, thank you very much for bringing us the update of the strike in the northern region. Let's go on to the phone now. We are joined by Franklin ANSAH, who is the General Secretary of the Health Services Workers Union. Mr. ANSAH, I'm grateful that you could join us here on JoyNews Prime. You had our correspondent talk about the plight of patients, families stranded, also in the Ashanti region. We got a report on the situation. They are simply pleading with you to call off the strike so you can attend to them. How do you respond to that?
Thank you. Yes, it is said in our local proverb that when two elephants fight, definitely the grass suffers. And this is the situation that we find ourselves. I don't think we have any problem with any patient or any family. It is just that the employer and the employee has certain differences that needs to be settled. I want to believe that, like it is being rumored that some of the employers or employers' representatives are saying that even even when the health services workers union members are not there, they will still be able to deliver service. I don't think this is the right time to be fighting over this.
Is that what you are picking up from the other, health professionals?
Well, I say it is being rumored. What we got is that the Minister for Employment is speaking with his colleague, Minister of Finance, and for that matter, something good will come up very soon. Let's hope that their consultations, they speed up their consultations, knowing the plight of the clients and also knowing the plight of Ghanaians. They will also speed up. It is two-way thing. So as much as you are pleading with us to go back, I think same please should go back to the ministry that they should also take in their discussions, such that we will be able to reach a conclusion.
Very well.
The two parties have misunderstanding and it's always the play going to one side. Then it looks as if one side is being difficult, but that is not the situation.
Very well. Thank you very much. That's Franklin ANSAH, the General Secretary of the Health Services Workers Union there.